Let's talk about chronic shoulder pain. Specifically for those that have not found answers, I have an idea, and that idea is that your shoulder pain is related to how you're breathing. More specifically, how airflow is occurring inside of your rib cage and affecting the position of your scapulae by extension. So, let's talk about how this works. Your shoulder is a humeral head and a glenoid fossa, which is a landmark on your scapula. This attaches to the glenoid fossa, glenohumeral joint. Now, here's where it gets interesting. This scapula has another landmark called the acromion process, and this acromion process attaches to a clavicle. And this clavicle attaches to this sternum. And this is how your scapulae actually move via the rib cage. Or this is how they attach to the rib cage is a better way of putting it. And this means that your rib cage, your scapula, and your shoulder are all kind of one and the same in terms of how they move. If the rib cage is doing something, it's going to affect the scapulae. And if the scapulae is doing something, it's going to affect the shoulder. Hopefully that makes sense. Again, it's a bit confusing. The shoulder is a complex joint to discuss, but just know rib cage to scapula to shoulder. That's pretty much what you need to understand, is that they're very, very interconnected. And that the rib cage is important to examine because here's where the problem lies. As physically and functionally asymmetrical human beings, we often find ourselves stuck in something called a left AIC pattern, which on a pelvis looks like this. And the pelvis in left AIC orients itself to the right. Right stance, left swing, that's what left AIC is. I've discussed it previously, not going to get too heavily into it. Now, to compensate, here's what happens. The thoracic spine orients itself to the left. And this is because if our thoracic spine followed suit with what the pelvis was doing, we would walk in circles forever. We need to find a way to walk straight and keep ourselves aligned. Anyways, bang, right? Left clockwise orientation. And here's what happens in this position. So you can see from this angle how this right half of the rib cage, this right hemi rib cage here, is coming toward the camera, and this left hemi rib cage is going away from the camera. Just trying to show you two angles so you can see clearly. No camera tricks, okay? And here's what happens when we orient that way. Internal rotation on the right hemi rib cage and external rotation on the left hemi rib cage. So you have to think less air on this right side, more air on this left side. And again, this is the best way I can exemplify it. Looks like that. Internal left, external right. Internal right, external left. That is how we have to think of it. Okay. So what happens in that position is this. That is a picture of what happens to the scapulae when you are stuck in a right BC pattern, which is that pattern I just showed. And I'm going to show you too with construction paper on this scapula, or not scapula, on this rib cage, what's going on. So with the left hemi rib cage, we are elevating. So this scapula is higher. It's sitting higher than the right. So this is the left scapula. And it's also externally rotating. So the edge of the scapula is coming off like so. Just to show you like that. And I'll show you on the other model just so you're not as confused. This doesn't move, but what would be happening on this left scapula is that this edge right here would be coming off more of the rib cage. That's external rotation of the scapula. And that's the position that the left scapula is taking upon that rib cage. In terms of the right scapula, it is doing something different. So the right scapula is depressed, as in elevation, depression. This one is lower than the left scapula, and it is internally rotated, so it's winging. And just to show you like that, edge is coming off here. And on this model here, that's what this would look like. This right scapula, instead of having this edge come off like we saw on the left scapula, now it's about this edge. And this edge is coming off instead of this edge. This would be internal rotation. Again, this guy is coming off. The medial border of the scapula is coming off versus the lateral border on the left. And again, I'll show it just for further emphasis. Left scapula is going to be elevated and it's going to wing like so. It's going to externally rotate. That is the left scapula. Right scapula is going to be depressed and it is going to internally rotate like so. So external rotation and elevation on the left, internal rotation and depression on the right. So how are we going to fix that position? Because the reason those scapulae are in that position is because of how this rib cage is stuck in right BC. The first thing we generally want to do when we're dealing with this issue is establish something called left ZOA, which I have a video on, but it's basically about making it so that instead of being stuck in this position all the time, where we have this right hemi rib cage stuck in internal rotation, left hemi rib cage stuck in external rotation, we get this thoracic spine to say, we're going to orient ourselves to the right, and bam, now we have left internal rotation, left hemi rib cage internal rotation, specifically right hemi rib cage external rotation because of how this is moving now. That is ideally what we want initially, and then to maintain that positioning, we want to have other muscles involved later down the line. So again, very similar to how we might have to treat knee pain, we need to start kind of on the ground and build our way up. Eventually get a left low trap and serratus anterior working, as well as a right low trap and tricep to maintain the ability to move from left trunk rotation to right trunk rotation. Very similar to gait. Okay, so I'm going to cut the video to me performing a technique that I think will help begin to establish left ZOA. But before I do that, very quickly, you need a balloon. Not going to tell you that in the video that gets cut to it. Just please, I bought these at Dollarama. You can get like 100 balloons for like $5. That's what I did. Try it, because this is important. It's going to provide diaphragmatic resistance and make it so that you train yourself to breathe and establish that left ZOA that we are aiming for. All right, cutting to the video now. So before I get into how to perform the technique properly, I want to go over proper positioning for this technique. So as you can see, I'm sitting in a chair. My left hand has a balloon in it. My right arm, right shoulder is behind my body, and my knees are shifted. So I'm shifting my left knee behind my right, or my right in front of my left, however you prefer to think of it, with my feet exactly parallel to one another. I am purposefully trying to shift my hips into a counterclockwise / leftward orientation. This is to ensure that my upper body, my thoracic spine, can actually rotate in the manner I desire. And the manner I desire is clockwise or rightward thoracic orientation. So again, knee shift, my right arm is behind my body, my left hand is holding the balloon. My right shoulder should be higher than my left shoulder. That's very important because we're trying to compress that left side as we perform this technique. And finally, I am rotating away from my right arm, or I'm rotating towards my left hand. This is clockwise orientation. This is the opposite of what's happening at the pelvis in terms of how the thoracic spine and rib cage are moving. So you can see me in this video get set up. I'm adjusting the position of my knees, getting my right arm behind my body, sinking down into that left ab wall with the shoulders, orienting my body that way. And now what I'm going to do is inhale through my nose and exhale into the balloon. And when you exhale into the balloon, one of the things you want to ensure that you are doing is use your tongue and keep it on the roof of your mouth. This is going to stop air from leaking out of the balloon and ensure that you have steady diaphragmatic resistance as you breathe into the balloon. When you perform this technique, if you're doing it right, you should feel that left ab wall compress as you exhale into the balloon. If you don't feel that, the technique is being performed wrong. But if you do feel that, then you're right on the money. You want to feel that left ab wall sink, compress, get tight as you exhale into that balloon, because that is what establishing a left zone of apposition is. And that is about it. Try it, practice it, give it 3-4 reps, as much air as you can fill into the balloon, and see if it works for you.